Over time, as the hands of the clock relentlessly move forward, many find that what was once an easy climb up the stairs becomes a real challenge. After crossing the threshold of 50, the feeling of waning strength and mobility in the legs becomes an increasingly common phenomenon. However, this should not be seen as an inevitable sentence leading to dependence and limitation of opportunities. In fact, there is a real opportunity to change the course of events, restore the legs to their former power and confidence. Strong legs are the foundation of active and fulfilling aging, allowing you not only to move in space, but to enjoy life in all its manifestations, maintaining independence and autonomy for many years to come. Neglecting the weakening of the legs can lead to a significant decrease in mobility and increased risk of falls and, as a result, serious health problems in adulthood. Fortunately, there are effective strategies that can solve this problem and significantly improve the quality of life. This guide is designed to shed light on the causes of leg weakness and inspire you to take effective measures to strengthen their strength and restore vitality. Let's embark on a fascinating journey to understand the origins of this problem and discover powerful tools to prevent its development. Get ready to change your approach to health, restore your legs to their former strength, and confidently continue your journey forward, enjoying every step. First, it is worth paying attention to age-related changes affecting the muscular system, namely sarcopenia. Over time, the human body undergoes a series of natural changes that affect physical capabilities. One such change is the gradual decrease in skeletal muscle and strength, which in medicine is defined as sarcopenia. This process begins around the age of 30, but its manifestations become more noticeable after 60 years. There is a decrease in the number and size of muscle fibers as well as a slowdown in the processes of muscle tissue regeneration. As a result, there is not only a loss of muscle mass, but also a decrease in muscle strength and functionality, which has a significant impact on daily life, leading to slower movements and an increased risk of falls and injuries. Awareness of the problem of sarcopenia is important as it emphasizes the need to maintain muscle health in old age. However, there is also good news. Sarcopenia is not an inevitable companion of aging if active measures are taken. For example, regular strength training is an effective way to combat muscle loss. Exercises that put stress on the muscles help maintain their strength and functionality. To perform exercises that stimulate muscle growth and increase endurance, you can use simple tools such as elastic bands or light dumbbells without leaving your home. Nutrition plays an equally important role in maintaining muscle health. A diet rich in protein promotes muscle tissue repair and growth. Older people require increased protein intake to compensate for the natural loss of muscle mass associated with aging. Including lean meats, eggs, dairy products, and plant-based proteins such as beans and lentils in your daily diet has a significant impact on maintaining muscle mass and strength. Secondly, a common cause of falls is peripheral neuropathy, which is damage to the nerve endings in the lower extremities. This disease, which is quite common in elderly people, has a significant impact on the strength and coordination of leg movements. Peripheral neuropathy occurs as a result of damage to the peripheral nerves, which are responsible for transmitting signals between the brain, spinal cord, and other parts of the body. Key factors causing this condition often include chronic diseases such as diabetes, which can trigger diabetic neuropathy, or a deficiency of vital nutrients such as vitamin B12. In diabetic neuropathy, prolonged high blood glucose levels gradually lead to significant damage to nerve fibers. This lesion mainly affects the legs, causing symptoms such as pain, tingling, numbness, and pronounced weakness, which can negatively affect mobility and balance. Similarly, a deficiency of vitamin B12, which plays an important role in maintaining nerve health and hematopoiesis, can cause similar neuropathic manifestations. Older people, especially those who adhere to strict diets or have problems with nutrient absorption, are particularly susceptible to this deficiency, which not only impairs the functioning of the nervous system, but can also lead to serious neurological disorders if not corrected in a timely manner. Prevention and treatment of peripheral neuropathy involve actively addressing underlying conditions and ensuring adequate intake of essential nutrients. For individuals with diabetes, strict control of blood sugar levels through medication, diet, and lifestyle modifications is crucial. This control helps slow the progression of neuropathy and can alleviate symptom severity. Regular consultations with healthcare providers, periodic blood tests, and maintaining an active lifestyle significantly contribute to effective diabetes management. From a nutritional standpoint, ensuring sufficient vitamin B12 intake is critical, especially for older adults whose bodies may not absorb it fully. Foods rich in B12, such as meat, dairy products, and fortified cereals, should be an integral part of the regular diet. For those unable to meet their needs through diet alone, B12 supplementation can be an effective alternative. Regular screenings to determine B12 levels can help identify deficiencies early, and timely supplementation can restore normal nerve function, thereby preventing the characteristic numbness and weakness associated with the condition. A third cause deserving attention is peripheral artery disease, a common yet often underestimated condition that predominantly affects older individuals. It leads to limited mobility and reduced independence due to impaired blood supply, especially in the arteries of the lower extremities. The essence of this disease lies in the gradual accumulation of atherosclerotic plaques on the artery walls, leading to narrowing of the vessels and hindering normal blood flow. As a result, during physical activity such as walking, the leg muscles do not receive enough oxygen, manifesting as pain, cramps, or a feeling of heaviness in the legs, often described as intermittent claudication. Notably, these unpleasant sensations usually subside at rest when the reduced oxygen demand can be met even with limited blood flow. Treatment of peripheral artery disease requires a comprehensive approach combining lifestyle changes and medication aimed at improving circulation and alleviating symptoms. Quitting smoking is crucial as this harmful habit accelerates disease progression and contributes to the development of other atherosclerotic conditions, further narrowing and hardening the arteries. Controlling blood pressure and cholesterol levels through diet, exercise, and medication also plays an important role in slowing disease progression and relieving symptoms. Physical exercise, particularly walking, is extremely beneficial for people with peripheral artery disease. Regular participation in a specially designed exercise program can significantly improve blood circulation, increase walking distance, and reduce pain. Such programs typically involve gradually increasing walking endurance, starting at a moderate pace and gradually increasing the distance and intensity of training as the patient's condition improves. It is important to understand that the pain that occurs during these exercises is not harmful. On the contrary, it indicates that the training is expanding the boundaries of circulation, which is necessary to improve the condition. In addition, regular visits to the doctor allow for timely assessment of the condition and adjustment of the treatment plan to effectively combat peripheral artery disease. A fourth reason lies in vitamin D deficiency, a problem that is particularly relevant for older people and has a significant impact on muscle function, increasing the risk of falls. This vital nutrient plays a key role not only in maintaining bone health but also in ensuring muscle strength. Over time, the human body loses its ability to effectively synthesize vitamin D under the influence of sunlight, and the kidneys lose their effectiveness in converting vitamin D into its active form. Such a decrease in vitamin D levels can lead to weakening of the muscles of the lower extremities and, as a result, to an increased likelihood of falls, which significantly complicates the performance of ordinary actions, such as climbing stairs or moving on uneven surfaces. Preventing vitamin D deficiency is both practical and vital. Regular sun exposure can significantly increase the level of this vitamin in the body. Just 10 to 15 minutes of morning sunbathing several times a week can help maintain adequate levels. However, with age, the skin loses its ability to effectively produce vitamin D under the influence of sunlight. Therefore, relying solely on sunlight may not be enough. Incorporating foods rich in vitamin D into your diet also plays an important role. Foods specifically fortified with this vitamin, such as milk, cereals, and some types of orange juice, can help increase your daily intake. Fatty fish such as salmon and mackerel as well as egg yolks are natural sources of vitamin D. In some cases, especially with limited sun exposure or dietary restrictions, it is advisable to consider taking vitamin supplements. Vitamin D supplements are an effective way to maintain a stable level of this vitamin in the body, which helps maintain muscle function and reduce the risk of falls. Regular medical checkups with monitoring of vitamin D levels will also help to identify the need for supplements in a timely manner and make the necessary adjustments to the diet. The fifth reason lies in a sedentary lifestyle, a scourge of modern society, especially among the elderly. Physical inactivity plays a significant role in weakening the lower extremities and generally deteriorating physical condition. There is a wise saying, "Use it or lose it," which perfectly reflects the essence of maintaining muscle strength and functionality. With age, muscle atrophy, often exacerbated by prolonged lack of physical activity, can lead to limited mobility and loss of independence. Such inactivity leads to the reduction and weakening of muscle fibers, which negatively affects balance and significantly increases the risk of falls and injuries. Preventing such decline is a paramount task, quite feasible through the introduction of more physical activity into everyday life. Simple yet enjoyable activities such as walking, swimming, or Tai Chi can have a significant positive impact. These types of activity not only gently treat the joints, but also effectively support muscle mass as well as improve cardiovascular health. Walking, for example, is an excellent way to engage several muscle groups at once, improve blood circulation, and increase the body's endurance. Swimming provides a comprehensive workout for the entire body, toning muscles without putting excessive stress on the joints, making it an ideal choice for people suffering from osteoarthritis or other similar conditions. Tai Chi, often referred to as meditation in motion, helps to improve both physical balance and mental well-being. Integrating these activities into your daily routine does not require Herculean efforts. Even minor adjustments can bring significant health benefits. For example, you can include short walks in your daily routine, whether it's walking to the nearest store instead of driving or a leisurely stroll in the park. Participating in group activities such as water aerobics or Tai Chi classes can also bring additional social benefits, supporting motivation and a sense of community. In order to make these activities an integral part of life, it is helpful to set achievable goals and gradually increase the duration and intensity of the exercises. It is important to remember that the key factor is consistency. Regular physical activity can slow down the process of muscle loss, maintain strength and flexibility, and reduce the risk of developing chronic diseases associated with aging. The sixth reason for weakening legs lies in osteoarthritis, a degenerative joint disease. Osteoarthritis, widely known as degenerative joint disease, is a common cause of muscle weakness in the legs in people over 50. It especially often affects joints that bear the main load, such as the hip and knee joints. This condition occurs due to the gradual wear and tear of cartilage tissue, which acts as a shock absorber in the joints, leading to pain, stiffness, and limited mobility. As the cartilage deteriorates, the joints lose their ability to effectively absorb stress, which forces people to avoid activities that create additional pressure on the affected areas, thereby contributing to muscle weakening and further loss of function. Preventing and treating the impact of osteoarthritis on leg strength requires a comprehensive approach that combines therapeutic strategies and lifestyle changes. Regular low-impact exercises play a key role here. Activities such as swimming, cycling, and water aerobics reduce stress on the joints while strengthening the surrounding muscles. These exercises help maintain flexibility and range of motion, reducing stiffness and pain associated with osteoarthritis. Strength training is equally important. Special exercises like leg presses, squats, and lunges can be modified to minimize joint stress while building muscle mass to support joints affected by arthritis. Strengthening these muscles helps stabilize and protect the joints, reducing the risk of further damage and improving overall mobility. In addition to physical activity, medication should not be neglected. Consulting with specialists may lead to prescriptions for anti-inflammatory drugs, corticosteroid injections, or, in more severe cases, even joint replacement surgery. These treatments aim to reduce pain and improve joint function, enabling individuals to participate more actively in daily life and exercise programs. The seventh reason to consider is drug-induced myopathy. This condition is a significant factor in developing lower extremity weakness in older adults, often going unnoticed. Certain medications can unintentionally cause muscle weakness, highlighting the need for increased vigilance among elderly patients and their healthcare providers. Statins, widely used to regulate cholesterol levels, are a common culprit. Despite their effectiveness in maintaining cardiovascular health, they can sometimes induce muscle pain or weakness, a condition known as statin-induced myopathy. This side effect is not only uncomfortable but also reduces motivation for physical activity, exacerbating leg weakness and mobility difficulties. If such symptoms arise, seeking professional consultation is crucial. Regular review of medications, especially when new signs of weakness appear, is paramount. Adjusting the treatment plan, whether by changing the dosage or switching to alternative drugs, can often alleviate these undesirable effects. For instance, if statin-induced myopathy is identified, a doctor may recommend a different type of cholesterol-lowering medication or adjust the dosage to minimize side effects while maintaining cardiovascular benefits. Besides statins, other medications such as corticosteroids and certain chemotherapy drugs can also contribute to muscle weakness. Careful management of these medications can help maintain muscle strength and overall mobility. The essence of the approach lies not in abandoning vital drugs but in optimizing their use to improve quality of life. Regular exercise, tailored to individual capabilities, and a balanced diet rich in nutrients also play a significant role in counteracting the potential negative effects of these medications. The eighth reason lies in osteoporosis and bone fractures, which pose a serious threat to the health of older adults. Osteoporosis, characterized by a progressive decrease in bone density, significantly increases susceptibility to fractures, which, in turn, can severely limit mobility and weaken muscle strength. As bones become increasingly brittle, even minor falls or accidental bumps can lead to fractures, especially in the hips, wrists, and spine. These fractures can be extremely painful and lead to prolonged periods of immobility. Prolonged immobility accelerates muscle atrophy and further reduces strength, creating a vicious cycle that can significantly impair an older person's ability to perform daily tasks and maintain independence. Preventing the development of osteoporosis and related fractures is paramount to maintaining a high quality of life in old age. A balanced diet rich in calcium and vitamin D plays a key role, as these nutrients are vital for maintaining bone health. Calcium provides the structural strength of bones, while vitamin D enhances the body's ability to absorb calcium and promotes bone mineralization. Older adults are generally advised to engage in regular weight-bearing exercises and strength training to maintain bone density and muscle strength. In addition, doctors may prescribe medications to help strengthen bones. Such medications include bisphosphonates, which help prevent bone loss and reduce the risk of fractures. Regular checkups and bone density tests can also help identify osteoporosis at an early stage, allowing for timely treatment before significant bone loss occurs. It is extremely important for elderly individuals and their caregivers to consult with doctors to assess bone health and receive individualized recommendations based on each person's health condition. The ninth reason lies in obesity and sarcopenic obesity, conditions that have a detrimental impact on the health of older adults. Being overweight and simultaneously losing muscle mass creates a double threat to the musculoskeletal system. On the one hand, excess weight puts excessive pressure on the muscles and joints of the lower extremities. The hip, knee, and ankle joints, forced to withstand increased stress, are subject to accelerated wear and tear, leading to pain and limited mobility. On the other hand, sarcopenic obesity, in which muscle tissue is replaced by fat tissue, further weakens the legs. Muscles become less effective, tire more quickly, which negatively affects their strength and functionality. The combination of these two factors creates a vicious cycle. It becomes increasingly difficult for older people to maintain an active lifestyle, which, in turn, exacerbates muscle loss and joint problems. To combat these negative effects, a comprehensive approach is needed, including a balanced diet and regular physical exercise. A nutrient-rich diet, low in saturated fats and moderate in calories, helps control weight and provides the body with the necessary elements to restore and maintain muscle tissue. Equally important is regular physical activity, combining cardio and strength training. Cardio exercises, such as walking, swimming, or cycling, help burn calories and improve cardiovascular health. Strength training, including exercises with weights, elastic bands, or body weight, such as squats and lunges, is essential for strengthening muscles and joints and maintaining their functionality. The 10th reason, which poses a serious threat to health, is stroke, also known as cerebrovascular accident. Strokes, especially dangerous for people over 60, have a profound impact not only on cognitive functions but also on physical activity, especially in the lower extremities. A stroke occurs when blood flow to a certain area of the brain suddenly stops or decreases significantly, depriving brain tissue of the necessary oxygen and nutrients. This leads to rapid cell death in the brain, often leading to long-term damage to the motor pathways that control the strength and mobility of the legs. When a stroke affects the motor cortex or corticospinal tract, it usually results in hemiparesis or one-sided weakness, which directly affects the function of the legs on one side of the body. This condition can manifest as difficulty walking, balance problems, and a reduced ability to perform everyday tasks independently, which significantly reduces the quality of life of an elderly person. Recovery from a stroke largely depends on restoring strength and mobility in the legs, which is achieved through physical therapy, gait training, and, in some cases, assistive devices. Preventing strokes involves actively managing risk factors. Key lifestyle changes include controlling blood pressure, one of the main risk factors for stroke. Regular monitoring and medication, when necessary, can help manage this risk. Quitting smoking and treating conditions such as atrial fibrillation and diabetes also play a crucial role in prevention. A low-sodium diet rich in fruits and vegetables and maintaining a healthy weight contribute to overall cardiovascular health, thereby reducing the risk of stroke. In conclusion of our comprehensive study of the factors affecting the strength and mobility of the lower extremities in the aging process, the time has come for decisive action towards preserving health and independence. Now is the perfect time to adopt one or two of the preventative tips that have been carefully analyzed. Whether it's systematic weight training, a balanced diet rich in protein and essential vitamins, or professional medical support for existing conditions. Implementing these seemingly minor, but in reality significant, changes into your daily routine can have a profound impact on overall motor activity and, consequently, on the quality of life as a whole. Equally important is consulting with your doctor to develop an individual health maintenance plan. This type of discussion will allow for a deeper understanding of advanced methods for preventing or managing conditions that lead to leg weakness, taking into account the individual needs and circumstances of each person. Every deliberate step towards preventive measures becomes a contribution to the longevity and strength of the body, ensuring energy and vitality for many years to come. Aging is a natural process, but the quality of life in adulthood is a conscious choice. Don't put this choice off. It is important to adopt healthy habits today, discuss them with your doctor, and confidently look to the future, feeling strength and stability.